This is UniTalk, the podcast series of the University of Debrecen. We've saved you a seat. In each episode, we'll show you a different aspect of life at UD. Students, professors, and researchers will take you behind the scenes to talk about their life, work, and passion.
Hi everyone, welcome back to the new podcast series of the University of Debrecen called UniTalk. I'm Dori and I'm here with one of my colleagues, Esther, today.
Hi.
And our guest today is Zuri, who's a dentistry student at the University of Debrecen.
Hi, thank you for having me. It's a real honor to come back and record another podcast with you guys. I think we had a good session last time and people really gave good feedback about it, so I'm glad to be back.
Yeah, thanks for coming back. So today you will be introducing your faculty, the Faculty of Dentistry. And before that, I would like to ask you to introduce yourself a bit, like where do you come from, whatever you find important to share about yourself.
Okay, my name is Mohammad Rez Amir, but as most people call me nowadays, Zuri in Debrecen because they find my name too hard to pronounce properly. I don't blame them, so it's fine. As long as they can reach me and communicate with me, it's fine. I am a fifth year dental student. I'm originally from Kenya. And that's about it, really. What else would you like to know about me?
Maybe how you got here to Debrecen. Why did you choose the University of Debrecen for your studies?
Well, I found out about the University of Debrecen through some agencies, educational agencies back home, and they told me about the University of Debrecen and the opportunities here and the programs of dentistry and how the course is structured. It really interested me and everything, so I ended up applying for the entrance exam and the interview and everything. So a few years later, we are here now.
And why did you choose dentistry?
I chose dentistry because I knew I always wanted to go into a healthcare program and I wanted to help people and all, but I was not too keen on medicine because I feel it's more traumatic or it's more negative to an extent compared to dentistry. Also, I am a person who really believes in family time and family life. With medical, it's a bit harder, and with emergencies and calls and everything, I think dentistry was a better option for me. Also, I think dentistry is a very, very interesting specialized field of medicine actually, and also I think you're a bit more independent. You don't have to rely on other people. You can do your own stuff, have your own clinic further down the line, so you're totally independent and you have no boss. You are your own boss, which I think is a huge benefit, because I know some cases back home and all that people are forced into hospitals where they have to sign contracts and have targets they have to meet and make people undergo surgeries and exposure to radiation and everything just to make the targets. So I don't think that's nice, and that's why I always wanted to stay away from that. So I think dentistry works well for me, and I'm really interested into it from a very young age.
Mm-hmm. So it can ensure your kind of independence? Mm-hmm.
Oh, for sure. It's a huge benefit to be independent and not have to rely on someone, or your job is at stake because of somebody else and you always have to be regulated or something. In this way, you are more free and you can do your work to your capabilities and no one is there to hinder you.
Mm-hmm.
Well, that's a good reason to choose a program. Coming back to dentistry, could you please describe your faculty a bit? Tell us about what you study, what you do there, what kind of courses you have.
Because you are in your final year of education, so we are quite sure that you have a lot of experiences concerning the dentistry program.
Actually, yes. The dental faculty is actually a very good faculty in general, and I believe that is even better than the medical faculty. Please don't hold me to it. But I think the practices we offer and the education we offer and everything is very good at a very high level. And education is, especially the practices and all that we go through, are very strict and regulated, and attendance and all, which I believe is something that needs to be done, as it's not only your education but it's also your professional outlook to this profession, and which is like if you come late, they'll give you an absence even if you're a minute late for any excuse. So that's just the professionalism, that when you're in a real clinic you cannot be late for your patients. You have to be on time. There are consequences if you're late and all. So I think it's a very good overall upbringing and an overall, I think, polishing of a person, and to develop them not only in the educational field but also in their real life. And to do that, we have many lectures, seminars, practices and all, and the information is progressively becoming harder or more advanced based on the previous years and the prerequisites. So I think it's a good way of building up your knowledge and consolidating everything. Also, like we have phantom practices in third year, for example, and before that we have mostly preclinical practices and medical practices to get to know the basics and understanding. After that, we normally have phantom practices in third year, as I mentioned, where they actually have a chance to work on dummies and practice fillings and tooth preparations and impressions and root canals and everything. So they actually know the steps and they practice the steps over and over again until it's ingrained into your memory and it's second nature to you, and you don't have to remember what you have to do because you will know you have to do it this after this after this. So I think that's very good, and everything is learned in third year, mostly the dental stuff that you need to know for your complex and clinical practices. Then we have fourth year and fifth year where we actually work on patients. So that's another extremely important thing that I believe, especially in dentistry, because it's not only about theory, it's a very practical field, and you need to have your hand control, your confidence with the patients, the way you talk to the patients, for example, even is a huge thing, and communication is a huge thing in anything in life, but in dentistry especially, to get the right information, to make them feel comfortable, and then you have your diagnosis and treatment planning that we do, and the teachers are always there to supervise it and guide you and pass their experience on to you and give you small tips and tricks. Oh, use this, do it like this is better this way. And I think that's what helps mold you into the dentist you are, learning from the different experiences from the different teachers you come across, and you can apply that to yourself, and whichever suits you, you can do it. So I think it's a good step and the good structure we have in this uni for dentistry to go on and have the practices done properly and to be a good dentist at the end of it. And I feel coming to the end of fifth year now that we have a lot of stuff that we have learned over the years. Obviously, we'll still learn much more after we graduate, and it's always like, I always say this in dentistry, that it's like getting a driving license. You get all your theory classes, you've done that. You get your practical exam, you do your classes, your hours, whatever, and you know how to drive now. But you only really know how to drive once you're driving on your own, independent of the instructor and independent of everything, without any guidelines or regulations binding you, no license plate with an L on it. You can actually go and learn and experience and practice it yourself. And that's, I think, when you actually know how good you are and how you can improve more.
And what's your favorite part of the dentistry program? Like, what was your favorite course that you enjoyed the most?
I think the courses really vary, and I would say my favorite subject, which I possibly want to specialize in also, would probably be orthodontics, because I was always very curious about orthodontics because you never heard much about it when growing up, and I was like, I wanted to see what it was actually, and I had an interest in orthodontics before I even studied orthodontics. So
can you explain what it actually is?
Okay, so sorry,
dumb people.
No problem. You're not alone in it, because even my parents themselves keep asking me, "Oh, which is the subject?" You keep mentioning me the names, but we don't know what the subjects are. So orthodontics is basically to do with the malpositioned teeth and the malpositioned jaws. So it's basically all the treatments, with braces and aligners and all of these techniques and the surgeries to correct your jaw positions and the different types of facial profiles we have to have a good aesthetic profile externally and internally. So this is what orthodontics is. So it is a long-term process, I believe, which takes over a few months, years even, to get the optimal position of the teeth and the jaws. So it's like a puzzle you're doing over the years, and you see the progress each month, and the teeth becoming better and better, and the shape becoming better of them, and the alignment becoming better. And so I think it's something that's a very cool thing, and it's like something you can be proud of at the end, that yes, I came from this stage where the patient was, and I brought him to this stage. And the best thing is when the patients are happy about the treatment and the work, and they see the changes, and they can relate to it and be like, yes, okay, I am happy with this. I think that's the biggest satisfaction you can get.
There are other specialties or departments at the faculty as well. Can you say some words about the other specialties as well?
For sure. We have many different faculties and dentistry, and people always, I have a lot of medical friends especially, they always tell me, oh, dentistry, what is it? You just open our mouth, drill one hole and do the cavity and the filling, and that's it. Dentistry is actually very very specialized, and it has many specialized branches in it. For example, one which is people will not even think of much or not know is preventive dentistry. But it's the most important field of dentistry possibly, because it is something that needs to be taught, or people need to be aware of, so that they don't have to come to the dentist. Luckily for us, we don't have any saying that an apple a day keeps the doctor away. So please go to your dentist. It just reduces the need to go to the dentist. But it's stuff like oral hygiene instructions and your brushing techniques and the diets that you guys should be having or not having. And we have a lot of programs for this, and to educate the general public about the effects of the diet and all on the teeth, and what they should do and not do. Coffee, for example, the staining of it, smoking. So, all of this kind of stuff is very important to have a balanced, and how to do it and everything. And even we have some techniques like fissure sealing, for example, which help save the teeth and all for children especially. So it's a very important field, but again, many people do not know about it. Another field I would say is pediatrics dentistry, which is a very specialist field, and it deals with children or patients from the age of 0 to 18. We have different sectors through it, like when you have early dentition and all starting from 6 months and then till 6 years, and then we have mixed dentition from 6 to 12 and then permanent from 12 onwards. So we deal with all the treatments that occur for all those patients. And for example, even some patients might have some developmental disorders like cleft palate, cleft lips and all, and these are stuff that can be treated alongside a medical team and alongside other specialists from the dental faculty also, but it's something that is done. I had actually a very weird experience, or I would not say weird experience, but something that brought me back to reality. One of my other options that I wanted to specialize in was pediatrics, because I was very interested in this, and I was always like, yes, I love playing with kids and I want to be around kids and all. It's very nice. So I was like, it's a good opportunity for me. I had one pediatrics practice, and there was a patient on the chair next to me, and she was being treated by the teacher, and I just saw some stuff and I was just like, no, I don't think this can be me. The patient refused to open her mouth, and the child I think she was maybe like 4 or 5. She refused to open her mouth, and she did not want to get any treatment done, although she was in pain. Showed her the instruments to make her calm and comfortable with the thingy, and that's where the trust was lost. And she never recovered from that, and she's like, no. Okay, we left the instruments on the side. It's just the hands. No, I do not trust you anymore. We even told her, there's this cream, just taste the cream and everything, because it's a pain-killing cream, so then she'll have at least some relief. She refused everything. And that's when I was like, is it possible to do this every day of my life, 5-6 patients a day? I was like, maybe not. So it is a very complex thing.
Sometimes you cannot win them with logic. If they decide on something, obviously, an adult will be like, okay, I really hate this situation, but I have to go through this. A kid will not go that far in the thought process. They would be just like, no, I'm out of here. No, I'm not doing this, so that I don't have to go through the discomfort or the pain. So
exactly, It's like this with them. And even candies and toys can only go a long way. They can't go beyond that. Like, even the parents give up sometimes with the children, or they're like, okay, I can't anymore. Like, I'm sorry, but I cannot ask her to open her mouth or force her mouth open or help you in this. And that's what it is, really. And you want to help them and treat them, but they don't understand what it is. They just see the needle, for example, and they just get scared. So I know in pediatrics dentistry, we have to keep everything behind this chair, and also they can't even see anything. And then we just kind of do it in the most secretive way, so they don't realize what we're doing. And the parents know, obviously, but to try to hide it from them, so scare them less a bit.
You've got some experience with that, Esther.
I have 2 kids as well, and we sometimes go to the dentist as well, and I know how hard it is to develop the trust. And my kids are also very much scared of those equipment and noises and all the needles. So yes, it's really a hard job. You need to have a lot of patience.
Yes.
And also promise them everything. Like, if you do this, then afterwards we can go to this place and that place, and I'm gonna buy you the toy that you want. Just please open your mouth and let them do their job.
So yeah, pediatric dentistry is again another specialist field, but it is something that is very time consuming, and you have to be very patient and tolerant for it to be able to do it. And although I am that, but I don't think I can do it every day of my life. So I think that one's out of the picture now. Going on, I think there's some other ones, like for example prosthodontics, which is, I'm pretty sure many people come across it, but they don't know what prosthodontics is. It's basically treatment where we do to replace the teeth, the missing teeth, for example, or to correct the aesthetics of the teeth. Like we can make crowns, bridges, posts and cores, inlays, onlays, dentures. And I think most people, when they get to the older age, they eventually get dentures, quite a few of them, especially what I've seen in Hungary. We have a lot of patients that come in who need dentures, and most of the cases total dentures when they have no teeth at all. So this is another field that I think is more catered towards the older age group of the population, but it's another one. We have restorative, which is I think generalized across the middle-aged population and even children, for example. We have 2 branches, which is the caryology and endodontics. So caryology is where we do the fillings and the cavity preparations and everything, and endodontics is what we do, root canals. Everyone's dreaded treatment, the patient and the dentist. It's a very hard procedure to do, and it's very limited visuality and the visibility of it and everything to see inside. and then you do something, and then you go to and check the X-ray, and then you're like, okay, it's good, maybe it's not good, short, long, everything. When you check it again, do it again. So it's a very time-taking and painful process for everyone, and the patient just has to sit there with their mouth open with the rubber dam inside and the frame and all, and they just like, okay, can I please go? And you're like, no, 5 minutes, I'm sorry, and you have to keep pacifying them and motivating them that it will be done, it will benefit you, but just please push through
but
it.
in the end, it saves them a tooth that doesn't have to be taken out. So.
And that's the thing, that's the biggest thing, and that's what we believe in dentistry, that we should do anything possible to save the tooth until it's not possible anymore, and then we have to extract it. It's fine. That's why we like to start with the minimally invasive treatment as possible, and then we try to go deeper and deeper and deeper until the last option is extraction, and then that's the final case, and then we're like, okay, extraction, and then in the future you have other possibilities to replace those missing teeth that we have extracted by maybe bridges or implants or dentures or anything. It can be done. Another one is periodontology, which is just the scaling. For example, you go to a dental hygienist or something, they scale it, and it's about maintaining the oral hygiene and the mobility of the tooth and the bone loss and everything, to check that, and have some complex surgeries regarding bone graft placements to reduce the mobility of the teeth and the bone loss, and periapical surgeries to treat any lesions and abscesses and cysts, for example. I think oral surgery, which is the hardest field of dentistry, I would believe, as surgery is for many, for medicine also. We have two branches, dentoalveolar and maxillofacial. Maxillofacial is mostly the external stuff that you see on the face and all the cheeks and the lips and everything like this. It's mostly due to developmental defects, or could be due to trauma from accidents and all. So I think that's another thing that is there. Dentoalveolar is the internal stuff like anesthesia, and you give extractions of the patients, removal of cysts, tumors, all this kind of stuff comes under dentoalveolar. Another one that I was actually interested in was also oral medicine, especially because in this university we study a DMD program, which we have so many medical subjects for, and we get a master's in dental medicine. So I think it's something that I was really interested in and all, to apply both fields into one. And you have an oral medicine, which is basically discovering all the oral pathologies in the mouth, which are linked to all the systemic diseases all over the body. For example, you can have diabetes, and what's the effect of diabetes in your oral cavity, and you can have kidney failure or renal or liver failure, and what kind of complications and what kind of medications and stuff like that you need to alter and everything. So it's a very nice field where you have a lot of freedom to see what the different options and aspects are of the treatment, and to interact with the different faculties and all to help treat the patient. And for example, cancers and everything is a part of it, lesions, any discolorations you see, so patients come to an oral medicine specialist to get it checked out and to know the reason behind it. And it's good to help them, because the oral cavity is an entrance point for a lot of other fields. So we can diagnose and we can see the stuff way before the other faculties can see it. So when we recognize something and we can see there could be some neurological issues behind for the patient, there could be some other reasons for the pain or the discoloration or the any texture changes or anything. So I think it's a good way, and it's a way of recognizing other issues. So I think it's a good field.
Oh my God, there's so many things to study there. So I wouldn't even know which one I would want to choose if I were in dentistry.
Before you have chosen your specialty, could you try out the other specialties as well, or how could you decide on one?
So basically it's we have all the different practices that go on. So alongside the complex practices, we also have special practices where we focus on each subject in person, and or like specifically on that one subject. And I think it really benefits, and also you get an understanding of what you actually like. And over the years, the different exams and all, and the different subjects we study gives you an insight as to, okay, this is my interest, this is not my interest. Like for example, for me, prosthodontics, which is the crowns, bridges and dentures and all, is something I do not like at all. I don't like working on it. I don't like doing the preparation of the teeth or anything. So I know for me, it's not something I would want to do in the future as a specialized field. Also, I think once we graduate from here, the degree gives a lot of platform and a benefit that we graduate as general dentists. We can work on all these different fields, and it can do and treat all these patients after we graduate. And then even we don't have to specialize straight away because we have to work for a few years. And I think those 2-3 years before specialization, you can get to know even more what do I actually like on a daily basis, and what I would like to work in the future for the rest of my life on. So then you can decide, okay, I like this field, I worked on it so many times, I've done it, and it's fine. For example, I did my first root canal on the patient, and before that I was like, I don't like root canals, it's a very boring process, it's the same mechanism, and you're going again and again and drilling the teeth and making it wider and the canals of it, shaping them properly and all. And I was just like, I do not really like it. It's a very difficult thing to, keep it and the patient and all in the rubber dam and all. But after I finished it and the outcome was good, I was like, it's not that bad now. It was worth the pain and worth the time that we put into it to help save someone's tooth. So that's the thing. Again, it comes with experience. You get to know what you actually want to do and what you like to do.
You have practiced then with real patients. What are the biggest challenges you face?
Yes, although dentistry is very interesting and all, but there are a lot of challenges you face with the patients and everything. One of them is, I think, and most people relate to this, is they're just scared of dentists and doctors in general. So there's a bit of a negative mindset or phobia around it, that if I go to a dentist or a doctor, there's something wrong. And also people are scared that they will do something. So that's one thing. Other thing is, for example, in dentistry very specifically, it's people are very scared of needles. When you have to give them anesthesia, people are very scared as to what it is. Other thing is, I know even my sister is very afraid of this, is the drilling noise and the scratching against the tooth. Some people are very sensitive to it, and in some cases it's very loud if you do the posterior teeth, and people do get really affected by it. I think the biggest challenge for me as a dentist working with patients is that when they love to move their tongue all over the mouth, they want to touch everything, feel everything, and I'm just like, please do not move your tongue. And I have to ask my assistant to force it down and everything, so they don't, because we have to isolate for some materials, and also they don't get spoiled and the filling is good, for example, or the root canal is good and we cannot have it contaminated, and they just love moving the tongue, and just like, okay, I cannot go on like this. If you keep doing this, it's going to be a bad filling and it's going to come out, so you have to stop. So you have challenges like this.
Yeah, but they don't see anything, so they just kind of like want to explore what's going on.
And do you have a supervisor while you work with patients?
Yes, we all have we are in groups of 4 or 5 normally, and we all have a supervisor who obviously oversees everything. And any questions we have, he comes and checks. Every small step we do, he comes and checks, or he or she, sorry, they come and check, and then they will guide you. Okay, this is fine. No, please polish it more, smoothen it more. This edge is there. There's still some decay left. Please remove it. So they're always there to guide you. And if you're stuck on something, you can ask them, and they actually do assist you. Because at the end of the day, they are real patients, and we cannot just let us just keep on going and trying. If it's not working, it's not working, and they do help out. So the patients are always safe. That's a guarantee, I promise you. And the
Talking about these patients, they are Hungarian patients, right?
No, actually, there are a lot of international patients that also come to us. A lot of our friends and all come to us, but in general, there's a lot of Hungarians. Yes.
And how do you communicate with them?
Yes, a good point. So in some cases, you do have, or actually, all the international students should know Hungarian to that level, because we study it in 3rd year. So we are ready for the 4th year and 5th year practices. But many people do not like to learn Hungarian, the international students, because they feel it's like not a very useful language. It's not like something Spanish or French or German or something that they can use other places in the world. It's something that's very localized. So that's why many people don't bother, and many people don't prefer staying here after they graduate, so they don't feel worthy, or it's worthy to learn the language. But when it comes to patients and all, they should know the basics anyways, and they can do it. Also, sometimes we have Hungarian assistants, so we have pairings of Hungarian and international groups together, assisting and working, or sometimes it's just Hungarian, sometimes international. But other than that, they can help also guide and tell the patient. But I think people can manage and all. And sometimes I know, even in my group, for example, sometimes my friends call me, can you please come and speak some Hungarian to my patient and everything. So I go and say, although not 100% perfect, but at least you get the message across and you know what's going on and they understand the situation. So it is an issue though.
Yeah, you do speak some Hungarian though.
Yes, it's picit. But I speak it, but it's not that fluent, and it takes, I think learning any language, it takes time for it to be, or to get comfortable with it, and you need to speak it regularly. And if you have people around you who can help you and guide you and tell you, okay, this is what you said wrong, do it like this, then for sure you can learn any language. And that's the best way of learning any language, or watching movies or something, or shows.
Would you be staying in Hungary after graduation or not? What are your plans?
I think Hungary is a very good opportunity to work in after I graduate, or anybody graduates. It definitely is an option for me also. I'm thinking about it, but nothing is for sure. My parents actually want me to come back home, so that's the main thing for us internationals, that we spend so many years outside here, and our families want us to come back and spend time with them. So it's logical to go back, but let's see what happens. But the Hungarian level of dentistry is very good. So I think people come from abroad to Hungary to work because they know the dentists from Hungary are good. So I don't know. Let's see. It's still in the future. Hopefully I graduate by that time, and then we can decide this.
You only have a few months left, so.
Yes, but those few months seem like a year, so let's see what happens at the end of it, and we will see and plan accordingly.
Okay. Now just let's go back a bit back to dentistry. There are a lot of developments in dentistry, I'm quite sure. Can you just name some of the developments that are also available at the university or that are the most interesting for you?
Yes, I believe like everything is advancing now and everything is becoming more technologically advanced and everyone's on technology and online and everything. Hopefully there are no robotics coming for dentistry any soon, so our jobs are not at risk. But other than that, I think there's a lot of advancements in it. And it's funny you bring it up because that's actually one of my my thesis topics is 3D and endodontics. So it's seeing the different technologies we can use in 3D and everything to improve the dental quality of patient care. Yes, in the faculty we do have a lot of equipment like this which is pretty advanced and we can use for patient care or to learn on even. For example, we have CBCT x-rays which are done in the radiology room. They're a bit more specific and specialized and we don't use them on a daily basis for each patient. They have a certain set of indications that we use them for, like complex cases, impacted teeth, cysts and stuff like this, or we need more clarity or visibility of some teeth and the positioning of them to the maxillary sinus, for example, or the mandibular canal, so we don't make any complications. So then yes, we do use them, but other than that, I think we have like CAD/CAM machinery which can be used to design and manufacture dental products. We also have intraoral scanners, digital ones, which is I think a huge thing, and I would love to have it in my clinic also because one, I do not like mixing the impressions. It's especially alginate, they are a pain and a mess to deal with and clean and everything. Even for the patient, it's just annoying, and you have some of it going back sometimes towards the throat and just gagging and like it's a very, very messy thing, and I do not really like it. So that's another thing. We have digital intraoral scanners, so I think that is something that can be used in the future, and I think that's what I believe in, that in the future more of these technologies will become available, and the more easily accessible they are and cheaper they become, people will use them, and the more research goes into it, I think there will be cheaper options, and I think it will become a standard in the next 10 years possibly. So I think dentistry is heading the right way, and the dental faculty has a lot of stuff that is advanced and useful for this. For example, microscopes even for root canals, which I told you is like so bad to see inside. If you have microscopes and you can see inside and loops and all, it is extremely beneficial. So it's a good aspect now.
Have you got some tips or advices for future or prospective students who are planning to start their dental education?
Yes, most definitely. I think the biggest thing is in medical or dentistry is that please don't do these fields if you're not interested in them. They are very hard fields, very specialized fields, and they require a lot of theoretical knowledge and practical skills and all. So I always advise this to people: do not get into them if you're not motivated to do it. It is very hard to push yourself through something that you do not like to do yourself. And I know it's a huge problem in my culture, especially that people are forced into these fields because they're looked at as noble fields and higher end fields, and also people tell them, families tell the students to go there. Please do not do it. If you're interested in it, only then go for it, because it is very stressful and tiring, and it will play on your every last nerve. So make sure you have enough patience and tolerance to deal with it. It is hard, it is stressful, but at the end of the day, it's the sacrifice we make in these 5-6 years here that is going to help you in the future. So if you're willing to sacrifice that time and put in the effort for it, you will have a good life after this for sure, but you need to be prepared to do that. And once you're here and everything, or in doing dentistry, I think it's very easy to find people who are at the same time as you and click with you and everything, and you can get along with them and work. So it's not hard, but it just I believe it's about regular practice. You have to just do it, and even the practices that you're doing, focus on them. Learn before your practices. Go for them so you know what you're doing, so you can get the most benefit out of it, and you know, okay, this is what I need to do for today, and I'm going to go practice this, and that's all it is. It's always about practice, especially in dentistry. It's all about hand control, doing the same fillings over and over and over again until you're 100% sure that this is how it is, and any patient that I will get, I know I have to do this kind of stuff. So obviously the patients are different and the cases vary, but in general the basics and the mentality behind it is the same.
Well, thank you for that. You explained so much about the faculty that even we didn't necessarily know because we're not, students at the faculty. So it was indeed very interesting. And well, good luck for the next few months. I hope you can graduate successfully soon, and whatever your plans are, whether you're staying in Debrecen for the next couple of years or going back home to your family, I hope it will turn out for the best for you, and good luck with it.
Thank you very much for your kind words and wishes, and it really means a lot, but hopefully we can be over this line soon, and let's see what happens in the future. Thank you and have a good day.
Also, for those who would like to find out more about the faculty, either the Faculty of Dentistry or any other faculty at the university, you can just go to edu.unideb.hu or write us an email, info@edu.unideb.hu. You can contact us on Instagram, TikTok, Facebook. You can watch our videos on YouTube, so all of the information is available for you online. And until next time.
Thank you.
Bye-bye.
Bye.
Bye-bye.